Okay, I'm with Vijay Palji here. I just checked his pulse, and in the pulse, it's showing uh, there are some changes in the Sadhaka Pitta, and also there is a Vyanava is there. It means, and there is a high stress levels also is there, and there is a Brajaka Pitta is there, and elevated, at the Gati level, and also there are movement of the Pitta and Vata at the Gati level, and there is a Sabdoshas Jnana Vayu is there in the pulse. And just as quickly I asked him whether he has any blood pressure. He said yes, he's having blood pressure, and it's very high and fluctuations. He's taking some medicines for the blood pressure also, and just checking him with blood reports, and he's an Indian, 54 years old, and there is a urea creatinine is very high. Urea is around 130. It should be 13 to 45, and the creatinine is 4.39 is there. It should be around 0.70 to 1.30 according to the European calculations. And there is also that means it clearly shows that kidney filtration problems are going on. So I'm going to check his abdomen and see the liver and everything. And he had an issue of cardiac ailment since a long time. So we are going to see the how can we make balance his cardiac ailment and all. Okay, Vijayji, what time you go to bed?
To India?
No, here. What time you go to bed?
10:30.
10:30. Sleep is okay, right?
Yeah.
Basically, in Indian people, they have this genetical changes in the genes itself, that the cardiac ailment is very common in Indian population, especially in men. So we need to consider that, and there's only way where we can change is the daily lifestyle changes, and also we need to give him some program with the Ayurvedic herbs. I'm going to give him, and the changes of the lifestyle is very, very important. Going to bed is very important, and we need to see what is the reason for his urea creatinine and increased levels. Now we need to work on the kidneys, and most important is Agni is important here for him. We need to work on the Agni. How is your appetite, Vijayji? Appetite?
No appetite.
Appetite is less. Okay. Let me see his appetite is low. Let me see his liver profile also. Serum bilirubin looks normal, 3.4. Okay, and he's trying to show me the serum urea here, and its latest, it is 15 to 45 should be normal, and he's under treatment, but still we need to check what is the reason for this elevation of urea and creatinine for him. Is it connected to the heart? So we need to see, and what kind of program we can give according to Ayurveda, what treatment we can give him. That's what we are going to work on with them now. So now liver profile, I'm checking the liver profile also for him. Looks. Do you take alcohol?
No.
Before you used to take.
Yeah.
So here's a history of alcohol also. Basically, in Indian men, we get these cardiac problems and everything because of the sedentary lifestyle and lack of exercises and sleeping timing. Basically, in India, they go to bed early, but the business and the stress levels, and also it could be problematic. Urine कोई problem नहीं है ना? You pass the urine properly?
यूरिन का प्रॉब्लम ऐसे तो नहीं है, लेकिन रात में 2-3 बार जाना पड़ता है.
Is there any blockages of urine for you?
नहीं, ब्लॉकेजेस का तो प्रॉब्लम नहीं है.
Okay. So now what we are going to do, the treatment aspect for the Vijayji is we're going to choose the diet which is the Agni is not functioning in him now. We need to choose the diet which opens the channels, that is srotas according to that. So there are, we all know that there are 13 srotas are there in the body, and pranavaha, udgavaha, raktavaha, all srotas are there, and Agni, Dhatu Agni. I feel strongly that in the pulse also there is a Agni showing in the dhatu level, which is at I'm sure I've seen in the middle finger the dhatu, that is Raktagni. Rakta Dhatu was showing in the middle finger. So we need to, we all know that the index finger is Asti Dhatu, middle finger is Rakta Dhatu, and this is ring finger is Rasa Dhatu, according to the Nadi Pariksha. So we're going to see how to fix these dhatus, and we're going to give him the good program. So mainly I'm going to work on the Dhatu Agni here. It's a very, very important point here. And of course the herbs and all, the protocols, what we have for which diseases and all, we're going to work on him. He's on the treatment now, and he must be improving with Ayurvedic treatments, and I'm going to give him some herbs after I come back with the protocol of the food. So now we are going to give him the treatment. I'm planning a treatment for him. So I'm just giving him some food, what he should not be taking, because srotas, they are getting blocked with the, vata avarodha. The srotas should be cleaned, as well as the Agni should be balanced. So I gave him the food and what are those things, and the sour milk products and all. Immediately I cut him, and ghee, allowed him to take a little bit ghee. This is very good for Agni. And I have because it's more of vata and pitta, this imbalances with the gati level, and there is an ama at the first level of the pulse. There is an ama was there, and there is a pulse also is irregular. This clearly shows that there is a problem with the cardiac level, and there is a serum creatinine is increased and blood urea is creatinine. So I reduced the water quantity a little bit, and hot water I asked him to take for 1 liter, and I try to give the food. And the berries is extremely good. I asked him to take the berries, blueberries, blackberries, and everything. And I'm going to give him some the medicines. Punanavadi Kashayam I'm planning for him. Gokshuradi Gugulu I'm planning for him. And Sarpagandhavati and Arjuna. It's a general protocol we are doing for him. For me, most important is the correcting the lifestyle, the food, and the mental state of the person, and the sleeping habits, timing of sleep, timing of eating, and which now this is spring season, what food he need to take. This is very important because there is a kapha is increased now. We need to see whether we have to plan for the kapha dosha balancing, or we need to see vata pitta balancing in the body. So these are the things I'm trying to work on him. And once I finish the protocols of these things, and I'm going to give him some breathing exercises of yoga, as he having blood pressure. So I try to minimize Kapalabhati. I try to go for Anulom Vilom Pranayam and Brahmari Pranayam, which will definitely help him. The increases sattva conditions, works on his prefrontal cortex, and balances his emotional state. And it's very important to look into trigunas when we are treating a patient, right? That should be fine for him, and he will come back in 2 months' time.